Maura, I want to talk with you a bit and just ask you, draw you out a little bit more on this question of partnering with other agencies in the government. As you've gone around with your tin cup, where have you gotten the most response, and what do you think are the most exciting potential collaborations going forward between different U.S. government agencies and USAID in some of these research and technology development enterprises?
Well, thanks, Susan, and thanks to my panelists. It was great to share the podium with you. A couple of things. We believe with NSF and NOAA, there's some geospatial technology that we think has a lot of applicability. You know, we think of the world being in the U.S., there's so much location technology that we take for granted that doesn't exist in the rest of the world. We're pretty excited about that.
Which could be used for what, for example?
Well, for example, on medical clinics, I mean, there's just a lot of, in the global health area, if you could really understand what the population, the distribution of the population, the distribution of the physicians, where the technology is, what the infrastructure is to get a refrigerated drug or vaccine to a certain place. I mean, it's just all that stuff that we take for granted in the U.S. that when you're in a Uganda or you're in remote parts of India become the difference. I mean, most of, 70%, I think it's 70%, but some huge portion of agricultural products in India never actually make it to market. And so if you really understood how to connect that, the geospatial technology will be enormously valuable. So that's one. We had a science and technology workshop with just about 60 or 70 people a couple weeks ago. We had 13 Nobel Prize winners, and we had the science leaders of everywhere in the federal government. So I say that by way of some of this is just beginning. So we've been talking with Francis Collins about doing things with NIH and how we might collaborate more. We've been talking to the Department of Energy about women as solar entrepreneurs worldwide, and they're interested in helping us do that. So those are just some examples of, I think, the collaborations that we're working on.
And what do you think is the biggest roadblock to more of this happening? Why is it just nobody's made the effort in the past? Have there been strict rules against this? Are there any particular constraints that have to be gotten out of the way for more of this to take off?
I actually think that almost all, we were the lead on the whole of government in response to Haiti. And I think and I'm really intrigued by Jeff's notion of whole of society. Because what I was struck by is that if you can marshal in a coordinated fashion the whole of government resources to solve a problem, it's just quite stunning. So for example, in disasters, there is, the issue is that how much communicable disease will show up and when, because all these people are together. We had an innovative driver who decided to distribute chlorine tablets with water. And we had 11% less diarrheal disease after the earthquake as before, let alone the expectation it would be higher. So I think I got off your question.
Basically, constraints for more of this collaboration on research.
I think it's imagination. I think it's status quo. But I was going to say almost every department we've seen in the last year or two has actually created some international division. So we think it's really creating new models about how to do that. As Corey said, some of us have the ability to do other things. NIH can do research funding, we can't. So part of it's getting clever about how you knit this all together.
So essentially, a provision in foreign assistance reform that allowed USAID to do research would be essentially eliminating constraint?
It would eliminate the constraint, but really, I think that you have to figure out which agency is best in class. Where you, I think, want to use USAID is to pilot and try out some of these ideas and scale them. I'm not so sure that the best use of our assets is to develop a core R&D. It's really a more demonstration and distribution network than it is a core research.
which gets back to the notion of having very seamless cooperation then among these agencies.
That's right. And also the other thing that is part of our interest that we are ramping up, and we've had a lot of countries interested, and that is building the science and technology capabilities of countries around the world. So in Indonesia, we're working on partnering 25 universities from Indonesia with 25 universities in the US. So as Corey says, I think there's a lot of opportunity to collaborate and also see discoveries that happen over there come our way and vice versa.
Corey, I wanted to draw you out a little bit more on this whole notion of the public-private partnerships and how lessons that could be learned from the venture that you're now engaged in with respect to the Hutch doing this with Uganda, but having support from NIH, having support from private volunteer sector in the form of the Duke Foundation, et cetera. How did all of that come together, and what are the lessons about making more of those collaborations happen?
Yeah, that's a great question. I guess one of the things that I'm struck by is that, I'm curious what Maura's take on this is, but I think that one of the things that does hinder sort of this interdisciplinary work, at least that I've seen on the ground, is, first of all, the mission statements of each of these organizations is very different. And it sometimes is hard to sort of knit a cohesive story together about how working on a project, let's say like the one we're working on, can actually meet the missions of USAID, NIH, the Doris Duke Foundation. So I think, first of all, we as scientists need to do a better job of articulating actually what is the mission and how this work can go towards furthering human health, making meaningful improvements, not just in the countries where we're working, but also here back at home, but also things like furthering the strategic interests of the United States in terms of foreign policy. So I think we need to be more cognizant as scientists and more cognizant as consumers or as the lay public about how these issues come together. So one, I think that there is a real need for the messaging. I mean, I actually think we don't do a great job about messaging in science in general. I mean, if I were to ask most people here whether cholesterol was good or bad for you, you kind of get this, well, there's good cholesterol and there's bad cholesterol, and sometimes it's good and sometimes it's bad. So science is complicated, and nuancing the messages is hard. But I think that really science and policy together are even more complicated. And so we really need to be very good and very clear about articulating what our goals are. And once we've done that, then I think, and this is what we really spent a lot of time doing, is what are our goals? And then identifying how different people who are the world's best are innovative in meeting those goals. So again, I mean, if we felt like our goal was to, our mission at the Hutch is to sort of, to ameliorate the suffering due to cancer. And if we want to do that, how do we do it? And so we thought, well, okay, we need to do research. Well, how do we do research? 90% of the funds at the Fred Hutchinson come from NIH. So as far as we're concerned, if you want to do medical research, you go to NIH. But we also recognize that if you want to do something about the suffering due to cancer, you've got to build capacity in healthcare. NIH doesn't do that. So we went and said, well, who does do this well? And we were pointed to USAID, and they do that terrifically, and they help. So I think that it's really articulating what is your mission, and identifying, I think you were saying this in terms of innovation, really identifying who are the best partners, and just approaching them with a unified vision of how they can bring something to bear to the specific problem.
Terrific.